on the Ministry of Health social media handle. Of course, our colleague Aaron Talo is also here from the anchor of the Liberian National Television. And today we are so grateful to say many thanks to the Minister of Health and our able deputies or technicians at the Ministry of Health for continuously working for the betterment of the health system of our country. And we are very humbled to have with us two distinguished personalities, persons of our Dr. Joel P. College, she's the Montserrat County Health Team Officer, and Dr. Baba P., Medical Director at the Liberia Center for Infectious Disease. And today we are going to drill them through, they are going to drill us through on the situational updates on MPOX at the Liberia Center for Infectious Disease. And that's a lineup for you. Just take a stay by your radio. Let's go for this quick brief. Where we'll come back. We get our discussion on beginning with Angel. That's Angeline Noah.
Welcome back and thanks for rejoining us. Before we dive into our discussion this morning, we want to read for you this important public health advisory that was issued by the Ministry of Health. It's very important that we read this. This was read on here last week and we want to read it again. But public health advisory, this press release, it was issued October 20th, 2025. It's a seasonal flu alert in Liberia. The Ministry of Health informs the general public of an increase in seasonal flu cases nationwide, with Montserrat County reporting the highest number. Common symptoms include fever, cough, runny nose, sneezing, sore throat, headache, body ache, and fatigue. High risk groups, children and students, elderly persons, pregnant women, individuals with chronic illnesses such as asthma, diabetes, or heart disease. Preventive actions: seek medical attention if you develop these flu-like symptoms and wear a mask when around others. Stay home when sick to prevent transmission. Wash your hands regularly with soap and clean water. Cover your mouth and nose when coughing and sneezing. Disinfect frequently touched surfaces. Avoid crowded and poorly ventilated areas. Government response: enhance surveillance in health facilities, public awareness campaigns in communities through the media, collaboration with the Ministry of Education to strengthen health measures in schools. The Ministry of Health assures the public that effective measures are being implemented and encourages everyone to adhere to these preventive actions to protect themselves, their families, and their communities. Dr. Catherine Thomas Cooper, Chief Medical Officer of Liberia, original copy signed. So, Melvin, with that read, we will now go back into our discussion, beginning with Dr. Colley, the Montserrat County Health Officer. Good morning, Dr. Colley.
Good morning, Angeline. Good morning, everyone.
I know you've been here several times. This place is more like a home now, but can you just tell us a little how it's work, and
Okay, thank you again. My name is Dr. Joel Tapekoli. I'm the County Health Officer for Montserrado. The County Health Team is the implementation arm of the Ministry of Health. So the same way you have Montserrado County, you have other counties, and we directly implement all health services at the county level.
okay. Dr. Vapa P, welcome to Roadway to Health. It's your first time.
Thank you very much.
We are honored to have you.
Thank you, Angeline. Thank you, everyone. I'm Dr. Vapapi, the recent medical director assigned at the Liberia Center for Infectious Disease. And I'm happy to be here working for the Liberian people. And it's important that although we are in Montserrado, but we are not only serving the people of Montserrado. And so we are happy to be here.
Okay. But before we deepen our discussion, focusing on our topic, can you tell us what exactly the Liberia Center for Infectious Diseases?
The Liberia Center of Infectious Disease is an entity or a service that the Ministry of Health has put together. It's a center, it's a built like a hospital because of the recurrent disease outbreaks we've had, like the Ebola before, the corona, and other times we have Lassa fever. Some days we have rabies cases. So the Ministry of Health have structured that area to be specifically responsible for the treatment of infections. Anything, when we talk about those infectious diseases, we're talking about anything that when someone have, they can pass on to another one if not taken care of. So that's what the Center of Infectious Disease is. And that's where we are assigned and taking care of people that are sent there or work in there with infection to be cured.
So, what are some conditions that you manage at the center?
Like I already started stating, currently we have monkeypox, a lot of monkeypox patients that have been treated through that center. If at all we have any new outbreak of any infectious disease, it will also be treated there. If you had a rabies case and you cannot be sent to the rest of the facility around the country, you are referred there. If we have what we call hemorrhagic fever, like we have Ebola, like we have Lassa fever, any of those hemorrhagic fever, because they can be passed down to other people easily, they take you there for isolated treatment. And so those are some conditions.
All right. Let's come to the County Health Officer of Montserrat County. Dr. Colley, just give us a backdrop about this mpox. The last time we were talking about it when it was being announced or pronounced to the public that it has hit Liberia. Where are we with this? What is mpox in the first place?
So, again, as you said, we've been talking about mpox. So, mpox is a viral, and it's spread by the monkeypox virus. It has been in Liberia for over a year now, but of recent, we've been having increased number of cases. So currently, from the situation, from the state rep from the National Public Health Institute, we currently have 1,234 confirmed cases. And of those confirmed cases, we've had 6 mpox-related deaths. Currently, we have mpox cases being reported all across the country, but Montserrat accounts for the highest. So sometimes you see me here because of the 1,234, Montserrat accounts for 854. That's over 65-75% of the total number of cases that we have currently. So it is here. We've been creating awareness. We will continue to create awareness. We've come again to, inform the public that it is here and what are some of the preventive measures we can all employ to see how best we can curtail this virus, and what are the basic signs and symptoms that we will talk about as they show, and where the public can get information from, where they can call if they need help, where they can get tested, where they can even get vaccines from, because we have vaccines in country that is available, but we have priority people that we give the vaccines to. Number one, I mean, maybe we can talk about that later as the show goes on, but there are vaccines available. So we just want to use this medium to inform the public that we're still creating awareness. Monkeypox is here, and where you can get help. What are the basic signs and symptoms, which we will talk about as the presentation as the show goes on. So thank you.
When the virus furiously broke out, the National Public Health Institute of Liberia announced 69 confirmed cases, and as of 2024 May, now you are announcing, telling the public that we have a very huge number here in especially Montserrat. Did you find out as a technician in the health profession as to why Montserrat is big?
I think because we in the urban settlement, and the cluster of people here as compared to other counties where you have. So if you look at the data, So those populated counties account for the highest number, even though Monserrado, so next to Monserrado is Nima accounting for 97 cases, followed by Grand Basso accounting for 44 cases, and then and the list goes on. But I think because of our day-to-day activities and how the county or the city is congested, so and how monkeypox spread from person to person using personal utensils, body fluids, personal like clothes and other things, and even sexual transmission is very, very high as well. So looking at how populated the county is, most times when it comes to disease outbreak, Monserrate is hit the hardest because of the, it's an urban area and it's highly populated.
So the deaths you talked about, how many females and how many males and their ages?
So I would just leave that to Dr. Pay when she's coming out, because it happened at the Liberia Center for Infectious Disease. So she will give more details on that in terms of ages and then male and female ratio.
Before we come to the strategies, we want to know the strategies you put into place. You will firstly tell us the kind of impact, I mean, the types of the case, I mean, of the impact of the virus and how people go about contracting them. But let's hear from Dr. P. Yeah, Doc, welcome.
Yes, thank you.
Yeah.
Begin.
Yeah, so she mentioned that you would talk more about the question. So just like
I'm talking about the deaths. You said you have, I mean, some people have died and succumbed to impacts. I mean, so
Okay.
I was
Okay.
asking how many females, how many males, and their ages.
I will begin by telling you, I won't tell you their ages, but I will tell you the age range.
Okay.
Specifically, they have been adults. We haven't had any child. We haven't had any pregnant woman. We haven't had any elderly patient. We've had middle age men and women. That's the age group, which is like between 30 to 50, in between there. And so we had a little more male than female in the total deaths, just a slight increase. And then these deaths have been linked not solely to monkeypox, or monkeypox, the fact that they developed the monkeypox virus or disease, obviously it became a death of monkeypox. But 100% of the deaths were people that had other serious underlying medical conditions, some unaware, some aware. So these were cases that led to deaths. Some of them even came dead before intervention. There were cases that we received patients that they were referring, but upon their arrival, they were already dead. Like we have one of such case. And so that's the overview on what the death is like. It's not like people just get monkeypox virus and then you died. You must have had some underlying medical condition, and serious one. It's not just any serious underlying medical conditions that are also non-evitable to death, because death occurs anywhere, even in a hospital, the general population, anytime someone can die. And so these people that died, although it was unfortunate that they had a monkeypox virus during the time of their death, but they had serious medical conditions that would have led to death even in the absence of monkeypox virus.
So you can you just tell the public how does this monkeypox affect somebody? How does somebody get it?
The commonest way you can get it is getting in contact with a surface or a person that has the virus or have the disease. First, let's look at the person. If you get in contact with a person that have the disease, some people have been thinking, they say, I can't remember touching anybody, but you touch those. And if people have the disease, their hands may be infected. They may touch this door, open the door and go, and the door is not disinfected, and you touch that same door, and then you can contact that virus in your hands. And that's why they say hand washing. And if your hands are not sanitized or washed, and then you apply your hands to your face, which is the easiest place that your hands can go, your eyes, your nose, or anywhere scratching, and then you can, introduce the virus into your system. We notice that the sexual contact is higher than the rest of the contact because the evidence is giving that we've had couples, a lot of couples coming into the center for treatment. So either the girlfriend and the boyfriend, husband and the wife, right? Couples. Yeah, there are a lot of couples that came down. So with that couple data that we have, we want to think that sexual intercourse is one of the fastest medium that you can get it, because it's not more easier to get it from just touching the surface if you were lucky to wash your hands. But if you have intercourse, it's 100% exposure. And so people that are also caring for people with the monkeypox virus, because if you are caring for them, you are having direct interaction and contact with them. And that's why if you are not aware on how to take care of yourself, you're not supposed to take care of someone that have infectious disease like monkeypox. Because if you use your hands and bath them, take care of them, you are also introducing the virus to yourself and you get infected. So these are the commonest ways. And how they present. Most of the time they present with rashes. Rashes are being key. And the important thing about rash is it is the rash that we use to investigate when you have that fluid in that rash. And so some people come, they have nothing on their skin, is their fear, and say they want to do tests. We say no. We are not testing the blood because it is not accurate as compared to the rash, the fluid from the rash. So those rashes, when you get those rashes, that's when you can go for testing. Not because you just got exposed to someone and then you run and go and say, do my test. No. And then another thing that comes often is the lymph nodes. Lymph node is this knot. If you ever had a situation where you had sore on your leg, for instance, they knot that stand at the upper part of your thigh, that can be very painful. That's why we call lymph nodes. So the difference between chickenpox, because people think that chickenpox will say no. So once you start getting that knot, chickenpox will not give you that knot. And that knot not only on the thigh, it can be under the arm, it can be on the thigh, it can be under your chin, it can be a lot area distributed on the body. And so the lymph nodes. So most of the time, once you get lymph nodes, and you get also, if you develop a rash and a rupture from your private part, and you start making also, just run for help. So those are key signs. The fever, the body pain, other conditions can cause that. So we don't want to emphasize on that, but those ones that are specific for monkeypox. And when you see, once you get fever, you get headache, you get body ache, your throat pain, everything, then you see a rash, or you see a knot, or you see a ulcer, then you know that it's serious. It's monkeypox.
Sometimes people would, I'm not talking about, people will say it's harassing, it's an infection, it can be commonly treated. So they would not take into consideration that this is a symptom of mpox.
That's why we are educating the public now that because we are in an outbreak, and these are the signs. When you see these signs, go to the nearest facility and explain so that the health practitioner can be able to advise you. Do not sit home and assume that it is rising, because it's one of the presentation that the disease comes with.
So you just touched the symptoms, right?
Yes.
So can you tell us what exactly the specific role that the Labrador Center for Infectious Disease play in managing mpox?
Okay, so the Labrador Center of Infectious Disease is like a hospital, it's a facility. You get admitted there. Like you can go to any hospital and they put you on bed. You get on bed, and in there, you are fed, you are given medication, you are given drinking water, safe drinking water. You are physically being cared for with any medical condition. And the good thing is, it is not only the monkeypox that you have we're going to treat. When you get there, we do an overall assessment and treatment of any condition that we find. Fortunately, I'm an internal medicine doctor, and so the center is blessed to have me, that I'm able to pick up a lot of other diseases other than monkeypox. And so with that expertise, we are able to help a lot of people. So even if you have different conditions, don't be afraid that, oh, if I go down only monkeypox, they treating, they will not treat me. No. So the center is like a hospital treating you as a whole. And you don't need to worry. You just come there, you get treatment, you get food, you get medications, you get everything. That's what we do there. And then after you are healed, improved, we discharge you, you go back home to the community.
So, what are some other strategies people are using to address this entire situation?
So she just spoke on one aspect, that is the inpatient treatment at the laboratory for infectious diseases. But we also have other strategies because number one, the capacity of the hospital can take the entire population just for Montserrat because they're not only treating patients only in Montserrat, they are treating patients across the country. So we have two forms of treatment. So we have what we call the home-based care, where people are being managed in their own home. The health team will follow you up at home, and also we have people who with severe cases, as she mentioned, that can be treated on an inpatient basis where you can go at the Labrador Center for Infectious Diseases. So that's the treatment aspect. But also there are different strategies we, put in place even before, the cases started to go up. But again, we have a tendency in this part of the world to doubt a lot of things. So when the issue of monkeypox came about, a lot of people, this is a rumor. The Ministry of Health ready for this, that, until people started seeing people coming down with physical, signs and symptoms of mpox before people tend to believe. But we've been creating awareness in the communities, in the schools, different places, in the, marketplaces. Currently, we're still in the field using the what you call the microphone in the communities to at least create that awareness to the public so that they can know what it is. I'm sure looking at the number of cases we've had, and I know people have seen a physical mpox patients, even in their community. So once you see signs and symptoms, most time this time, they are reporting themselves. Unlike before, where we will go in the community, they are coming themselves. So that's a good sign that at least the awareness is going out and people are actually believing that this thing is in Liberia, it exists, and then where you can get help from. So aside from the home base, the public, the awareness, also we also have, vaccines that are available that we give patients. Most people who came in contact with a confirmed case. So the vaccine is not for the patient actually, because vaccine is there for prevention. So if you came in contact with a positive case, the surveillance we will do a land list, what we call land list. They contact people who you came in contact with, and those people they are actually eligible for vaccines, and we've been vaccinating as well.
So, what do you use since you can't use the vaccines for those already infested with the virus? What do you use to kill them?
So, like any viral infection, so there are different protocols for treating. For most viral infections, they are treated symptomatically. But for monkeypox, for the lesions, we give for the lesions, they are cleaned and we apply something called calamine lotion. So people in the layman thing, they say calamine lotion, but it's called calamine lotion
On the surface.
On the surface of the skin, and they are giving some form of antiviral medication that will help. And then they are also managed based on the different signs and symptoms. So if they have fever, they give them something for fever. If they're feeling pain, they give them something for pain. And those with very bad lesions, they are cleaned. And those are the ones that are emitted, they are clean, and then those wounds are also managed. And if they have co-infections, as Dr. P mentioned, those co-infections are also treated. Like a patient who maybe might be HIV positive, TB positive, or coming down with other medical conditions like high blood pressure, diabetes, those conditions are also treated as well.
Okay. Well, at the call we were talking, we made mention of the home-based care. How is it done? How effective it is?
So it is really challenging, most especially because you can to keep someone in a confined space without proper monitoring. It's something that we're still struggling with. I must admit, it's highly challenging because if we can admit you, we say stay home. How sure are we that these people are actually home? What guarantee do we have? We will go there once or maybe once a week, or maybe follow up by phone. But again, you can't police someone to say stay home. So we're just providing that education that if you have the symptoms and if you are not that severe, to go to the center. If you'll be managed at home, the health team will follow you up. But again, we have to be responsible, for our health to listen to all the different health advices. Stay at home, keep yourself isolated, and then as we follow you up until but the recovery process, even in the home base and at the center, it has been really, 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 really good.
Dr. P, how equipped is the Liberia Center for Infectious Disease in terms of resources and other things?
The Liberia Center of Infectious Disease was established or built by partners in the Ministry of Health, the government of Liberia through the Ministry of Health. Like some contribution was done on different entities. And then the running of the entity is by the Ministry of Health. It's solely run by the Ministry of Health. And so it is the government that is providing funds and everything to keep the day-to-day activities, the medications, the food and other things. There are once in a while some tips that might come in, but it is not adequate to cover the expenses. So it's the government that is really taking up the responsibility. And the center, we have currently, we have actively 15 rooms that we are using. And then we also have an ICU. But the ICU, I must admit, because the public need to know the challenges that we also have. So we have not come to prove that we have everything rosy. So we also want to let the public know that we have some challenges. Let's talk about space. So you see that has been there was a time that we had increased patient. We were even thinking about rearranging the entire area to expand and bringing more beds and everything when we started going above 60 patients per day admitted. But then, blessed, it went back again in the 50s. So we have been between the 50s and the 40s. So between 60 to 40, that have been our daily admission data. And the ICU is there, there are equipments there, but we still need more support to equip it so that we cannot get a shock. Because for now, we are not getting very critical patients that need to be, for instance, intubated. That means to put an oxygen tube into the person and give to them. But we never can tell what's going to happen. So we still need some support in terms of equipment. A lot of equipment are needed, a lot of support medications and everything, because the turnover is fast. You might think that when we say 40 is small, but we are just discharging and admitting. I can tell you that as you discharge 20, that day you might admit 12, and the next morning you come back to 20 re-admitted, and then so it's like you discharge, and the turnover is very fast. It's very fast because people go there different times. So the turnover is fast. So you would think that the area is small, but there are a lot of people that have benefited from the services there.
Do you also you spoke of the lack of equipment. I mean, you have equipment, but you still need more.
Yes.
But do you have the effective workforce to operate the equipment?
Yes. We also have, we have different departments. There is this integrated program where when one system is overwhelmed, you call for help, and then other systems to support or other facilities to support. So that is something we've been doing when we needed anesthesiology, for instance. Those people that work with the surgical team, when you have the critical patient and you need anesthesiology, you just go and then you ask some of the entities like JFK that have most of them assigned there. They send the person, they will render that service, and then if possible, we'll train one or another person to do the monitoring, and then they go back. So that's how we're being integrated. So that's why I said there is no need to be afraid. Even if the qualified person is not 100% assigned there, we work with people coming in and going back giving services.
Okay. How are patients received diagnosed and admitted at the facility?
Patients are received either by a referrer for any of the health centers, clinics, or hospitals. Sometimes they will come in ambulance. Other time you will see self referrer where they walk in and say, I've come, I want to get treated, I want to get tested. But another thing the public need to know that area is not a testing center. So it's a treatment center. So there are other places that they do testing, but for the Liberia Center of Infectious Disease, it's a treatment place. So people that come there, we take them in, send their specimen, or their body fluid. Let me break it down. Body fluid, and then they will test it, and then that result will come back to us. So you can walk in once you have significant sign, like we have described. Nobody need to give you a paper to say go for treatment. You just walk in when you come to the gate. You identify yourself. Well, I'm XYZ, and I feel sick, and I see something on me that look like monkeypox, and so I came for you to verify. So what we do now, we verify, we assess you and see whether you meet the case definition. If you meet the case definition, we are convinced that yes, this is likely monkeypox, and we put you in an isolated place, send your specimen, care for you, and wait for your result to come.
Let me ask the CHO of Monserrado. You have raw Monserrado, most of the terrains are happy areas, and you spoke of tracing, tracing monkeypox or contact tracing and all of that. What's about those areas that are inaccessible to road and you don't have medical facilities there? What do you do?
So we have a decentralized system at the Ministry of Health, at the county, at the district, and even at the community level. So let's start from the county. We have the county health team, we have the district health team, and each district for Monserrado, we have 7 health districts. And the district health team have the district health officer, the same way you have the county health officer. We have a decentralized team. And at the county level, the district level, I'll go down to the district level. We have surveillance officers at the district level. And even those districts are also divided into zones. So we have zonal surveillance officers. So at the level of the community. So they are there to track down, cases. We put those cases to the nearest health facility. So it's not that we wait for them to come. So the county, the structure is divided into district and then also zones. So at the district level, for example, you have Commonwealth District. Commonwealth District is very big, it's also divided into zones. So we have the district surveillance officer, and we also have the zonal surveillance officer. And then recently, with support from other partners, we've also recruited people what we call contact tracers, and we also recruited people what we call active case finders. These people go in the community. So what we do when we get the data, for example, we have for example, we have someone from Claratown, maybe a community in Claratown or positive case. The active case finder will go in that community to ask around that community where we have a positive case to see where there are other cases. Maybe they're now reporting themselves. To go after them and actively search for them. So that's where the active surveillance come in. So we're going to look for them.
Where are you getting your vigor from? Where are you getting your strength from in terms of doing what you do? You are overly working.
I know it's not easy. Again, I mean, it's not easy. But with the issue of monkeypox, we have, the Ministry of Health. So at the county level, it's not Ministry of Health infill; it's the entire health system. So Ministry of Health, the National Public Health Institute, we all work together. So even the surveillance officer, they are directly on an infill, but they are at the level of the county. So we also have support from other partners like WHO that will sometimes provide vehicles, and the active case finders in the community. They are, provided small support from WHO. We have Afinet also helping. We have our other partner called FHI TBC State. They also, helping recruiting these people, and then they are, somehow compensated with something small directly to their mobile phone at the end of the month. So we've been having some support from other partners, WHO, UNICEF, Afinet, FHI 360, and other partners. So the National Red Cross. We have, other partners. So maybe if you're listening, if I didn't call your name, I'm sorry. It was just an oversight, but we've been having some, support from other partners. And at the county level, we have the national, we have the national IMS at the FL. We also have, at the county level, we have the IMS, which we, partners come and attend our meetings. We, present our plights, and then we also brainstorm on how we can all, put ideas together to control the spread of the monkeypox virus.
All right. Angel, let me just read this. It's from the website of the Facebook page of the Minister of Health, of course. The Minister of Health, Dr. Louise Mboto, yesterday conducted a series of unannounced visits to several primary health care facilities across Lofa County as part of the ministry's ongoing efforts to strengthen the primary health care system and improve service delivery nationwide. During the visit, Dr. Kuto assessed the quality of health services, the availability of essential medicines, and the working environment of health workers. She also held direct interactions with patients, community members, and facility staff to gain first-hand insight into the challenges affecting service delivery. The health minister also reaffirmed the ministry's commitment to ensuring that every Liberian has access to quality, equitable, and affordable health care, regardless of location. She emphasized that these surprise assessments are an important tool to enhance accountability, motivate health workers, and ensure that health facilities adhere to national standards. The ministry remains committed to strengthening the foundation of our health system, the primary health care level. These visits allow us to identify gaps, listen to our health workers, and take concrete steps to improve service delivery for our people. Is the Minister of Health speaking there. And these visits are intended, like you heard, just to motivate the healthcare providers, unlike in the past. But we want to say congratulations to the Minister of Health and her technicians and all those that are working in the health sector for bettering the system. We are so proud of you, and we pray that you get the necessary support to keep doing what you do for Liberia. Enjoy. I think we can take some calls. Would that be okay? We can hear from Dr. Pay, or we take a few calls quickly from the public because they are the direct beneficiaries of what you are saying. So we announce the numbers 0880514096, 077597853, 080514096, You can call, be part of the conversation this morning. Is on your way to help on ELBC Radio. It's always a pleasure when you listen and listen very well to have these health experts speak to you about how you go about doing what you're supposed to do to prevent yourself from contracting these dangerous illnesses, of course. Let's go to the line and you can talk to this person.
Good morning. Your name and where do you join us from? Okay, go ahead.
Yeah, that I feel equipment. I just wanted to know Ben and Megan what you like this.
Dr. Pay, did you hear that? Can you repeat?
He's gone.
Okay.
He said
Maintenance?
she talked about equipment in the center. How is the maintenance aspect like?
Okay.
So you want to speak to that, Dr. P?
Sure.
Yeah.
We have these biotechnicians that work with the Ministry of Health, and although currently we don't have a specific one assigned with us at the facility, but whenever we have challenge with any of our equipment, we get to the ministry and then they assign someone that can help us. Just yesterday, I was opportune to have the Enfield boss visit at the center, and that was another thing that I just discussed with her, that we would like the biotech to come again and reassess some of our equipment to make sure that they are all up to standard and functional. And so that's how we get it.
Okay. Good morning. Your name and where do you join us from?
Yeah, my name is Houston, I call from rehab.
Go ahead.
Yeah, my thing is, right now we're experiencing a change of weather. Everywhere we experiencing a lot of cold. Why is the Ministry of Health doing to tackle this issue? That's something.
Okay. 08805140096 and 0775677376 are the numbers to call us this morning. Good morning.
Morning, how are you?
I'm fine. Your name and where do you join us from?
Jamaica is calling from Ghana Street.
Go ahead.
Yeah, I just listened to the advice from the doctor concerning about the money for about for me, I have problem. I have rashes all over my body. Can I allow to come there?
Okay, the data will respond to that. Data Pay, you can respond to him.
Okay, so once you have those rashes, I will advise you that now you don't even go to any facility, because if you go to any hospital, they will send you. So if you have the means to come, straight they ask for the Liberia Center of Infectious Disease at Starbase, Beaumont Beach. We are located at Starbase, Beaumont Beach when you are going to Allah. And then where the ETU used to be for Ebola, that's exactly where we are. You will come in there and you will get treated. But if you do not have a means to come, then it means that you have to go to the nearest clinic and report yourself, and then they will call what they call the EMS, the emergency ambulance. They will call the ambulance, and the ambulance will get you from wherever you are and take you to the center. So please do that as quick as possible.
Okay, 0880514096, 0775-677-376 are the numbers to call us and be a part of this discussion. Dr. Cody, do we have concern that you want to respond to, or
If we can take this call.
okay? Good morning.
Yeah, good morning.
Your name and where do you join us from? Go ahead, you're live.
Yeah,
Can you walk away from your monitor?
Yes. It's so sad. We are sorry with that. We want to continue.
Yeah, you can walk away and call us back.
Morning. No. Listen, excuse me, sir. Sir, Bossman, please listen. Bossman. Listen to us, Chief.
Maybe off.
What? Okay. They radio that conversation, yeah? Morning. Please go ahead, sir. Go ahead, sir.
Yeah, my concern has to do with the opioid challenge that we're experiencing. Yeah, part of the beginning of this month. Everywhere in the country you call, we experience the same thing, same condition. So I don't know what mechanism the health ministry is putting in place to see about it. Because the pool is all over.
Oh.
Okay.
Thank you. Let's take this first, and then we'll go to our guest. Morning.
Good morning.
Go ahead quickly.
Oh, okay. I'm Norman J. Shekula, a retired laboratory technician for the Ministry of Health.
Go ahead.
I just want to
Sir, Chief, you play radio behind you, man. Then you call in, Chief.
I'm not playing radio piano. I'm using my phone. I don't have radio at all.
Okay, go ahead now.
Okay, I told you I'm a retired laboratory technician for the Ministry of Health. I just wanted to throw a little light on what she called the NAT, which we call in medical terminology the lymph node. The lymph node are in the body, whether you are sick or not, they are there. They are there to fight against diseases. So if you have the lymph nodes store the lymphocytes in the body, they go there to the infection. That's why they are inflamed. That's why they get swollen up, and you get fever, and you tend to get sick.
Okay.
So I'm just trying to let the layman know that it is not on that. It is not on rising. Whether you are sick or not, you have them. You have them under your cheek. You have them between your thigh, and you have them on other part of your body.
All right.
They are there to fight diseases. They should not take it to be rising. I'm just trying to know what she said.
Thank you. Thank you, sir. Thank you. Thank you. Let's go back to the guest.
Yeah, so Dr. Cody?
Okay, so I think two of the callers mentioned about flu. You know, when the ministry released that about last week, prior to last week, we've been having series of calls from communities, from school, flu in the air, but we have 2 seasons in Liberia, and once we get transitioning from one season to the other, you have increase in these symptoms. So we call it flu-like illnesses or seasonal flu, but it's also caused by a virus. So we have the influenza A, influenza B, and these viruses, they are in the air, and they can be, at its peak during these seasons. So some of the calls we've been receiving about, flu. even a couple of schools were closed last week. I would not mention their name. Classes were shut down because almost all the kids in the class had flu-like illnesses. So we thought it wise. We investigated. The county health team went in and we collected samples, and those samples were taken to the um, National Public Health Reference Lab, LIBRO, and those samples were tested. Some were negative, and also some were positive for influenza A. But the thing is, the thing with flu, they are all managed the same, almost like any form of respiratory illness, like cough, cold. So the basic precaution or prevention that we want to educate the public. We've also said it last week and again on the Ministry of Health page. Cover your nose and mouth when you're sneezing. We don't have flu shots in Liberia, where other countries like the US, during the season when you have it approaching the winter, you have flu shots are given to people. We don't have flu shots. So what we can do is just to enlighten the public of this, and also how we can prevent each other from getting the flu that is also in the air. When you coughing, cover your nose, wear nose masks. When you're sneezing, wash your hands as often as possible. Stay away from people who are coughing, sneezing, and stuff. If you're sick, also seek medical treatment. But most times, some of these symptoms go away within a week or two. I mean,
Okay. I mean, we are approaching time, but it's important that we touch this. The treatment process at the center. What is the treatment process like, especially in terms of medication? Is it free of charge? I mean, one that therapy.
Okay, so all treatment at the treatment center is free of charge. The government is providing the medications and have provided the health workers, the doctors, the PEs, the nurses, the nurse E, who are there and doing the physical care and every other thing, not only medication. Everything at the Liberia Center of Infectious Disease is free. So if anybody takes money from your relative or your loved one there, it means it's a form of corruption and it needs to be reported. Because as far as I know, to my knowledge, there is no one allowed to ask anyone for a penny at that center. The only addition that I might add is, for instance, you had this rare, when we say rare, is something that is not common in the hospitals or the health facility disease that you have to get treated for. Probably you were lucky, you even got the diagnosis, they told you about the disease before you came in, and you have been on your treatment. And that treatment, we don't have it among the medicine provided for the service at the center. We encourage you that, okay, can you communicate with your loved ones to make sure that they get more of this, your medicine, so that we can continue on your medicine so you can stop, because it's not among our list. Despite the director work out for modality, trying to see if they can find donors or petty cash or whatever to see how we can cover up. But there are times that we appeal to the relatives to help us with those rare conditions. They are not conditions, they are not impulse related conditions. It means this is something that you have that is not mpox, and the medicine for it is not on our drug list. And so we beg you that please, to help you, your relatives can help us and see if they can donate some of your medicine so that we can continue your care, not to have a break in your treatment. So those are things that we do there.
Dr. Cody, want to add something?
Yes, I think Anisha said it. So the medications are free, even for those that are being managed at home. What we started initially, we used to provide some form of medication, which we go very low on. So we just write we don't take money from anybody again. We just write the prescription, ask you to buy it, and then the health worker usually follow you up.
Well, how long do patients stay at the Life Solution Center before being discharged?
It's a range, because like we said, there are other people that have other medical conditions, and when somebody comes very sick, even if they are improved, maybe the rashes are improved, or if the other conditions they came with are still serious, you cannot just discharge them to go home. So the average has been between 1 to 3 weeks. That has been the average. In rare cases, there are people that stay there close to a month, and those people is not but I want to emphasize this. It is not the monkeypox that kept those people in the facility that long. It is other conditions that they had, but because they have monkeypox, other facility might not be comfortable to receive them if we discharge them fast, because they still have the mark of the lesions on them and everything. And so we have to keep them there and make them much stable to get home before we discharge them.
So, okay, Dr. P, we don't have time now, so you can just give us your party comments, then we'll come to Dr. Colin.
Okay, so I want to appreciate the ELBC radio and everyone here for the opportunity giving us the platform. I want to appreciate the government of Liberia through the President, His Excellency President Joseph Dumont Boakai, for the support. The Ministry of Health, the Minister, and all of the staff and senior management team, the MFA Director and boss that has just visited me. I want to say thank you. I appreciate your visit. My strong colleagues, the work of the staff at the Liberia Center of Infectious Disease, both the administrative arm coming down to the security, the health workers. My colleague, Dr. Rachel and Do, I salute you for your help, your hard work. Okay. I appreciate you. And so to the rest of the audience, I want to let you know that whatever we stated, take care of yourself, report yourself. We will accept you. You don't have to come by someone sending you or a referral paper. Once you have those rashes and those things that we talk about, come to the center and you will have the best of service.
Oh.
Dr. P is there to accept you and care for you.
Yeah, so Dr. Colin.
Okay, so thank you so much for having us here. We just want to conclude by saying to the public that please, our health is in our own hands. We will provide the necessary information, but you have to take it. Don't be doubtful. Monkeypox is in Liberia. We have cases coming up. Our cases are increasing on a daily basis. So part of it is that by next week, I just didn't announce it earlier, but by next week we have mapped out those high burden communities where we have increased number of cases, and we will be doing something called ring vaccination in those communities. So please watch out. The health team will be visiting those communities even before the campaign starts. So we're going to start like a massive monkeypox campaign, but specifically in hard-burden communities based on the data that we have. So we'll be vaccinating, and we also want to use this medium again to create the awareness. Please, if you have rashes, lesions, or if you have relatives, please don't stay home. Report to the nearest health facility. Your samples will be collected, and once you collect the sample, your results are out. We'll notify you, and then if you are to be managed at home, we'll let you know. If you to go to the center, we'll also let you know. So please. Thank you so much for having us today.
Okay, so with that, this is how I would like to leave you on today's edition of Roadway to Health. Many thanks to our guest, Dr. Vapa Pei, the Medical Director of Liberia Center for Infectious Disease, Dr. Joel Tapekoli, Monserrado County Health Officer, for providing update today on mpox in Liberia. We have been your host this morning, Angela Noah and
Melvin Stewart.
And Augustine Garima has been here. Until next Tuesday, have a good day.